many drug users will place drugs rectally instead of orally to get more effective high. Objectively, could testosterone cream be applied inside a clean rectum to be more efficient than the testicles? Okay. My own physician, Dr. Barry Breger, when I met him, he was a big proponent of using the compounded cream, but what he was doing was applying it rectally, figuring what better way to have it absorbed instead of just applying it to the skin and having it absorbed through the skin. So he was applying it rectally. And he was getting consistent blood values with that. He was getting good results with that. He had a lot of patients doing that as well. And then I started telling him about the transscrotal application where it's applied to the scrotum twice a day. And initially he said, well, rectally or at the scrotum, the scrotum skin is very, very, very thin. And yes, it does have very good absorption. So what's the benefit? And the benefit was that because the scrotal skin has a high prevalence of the 5-alpha reductase enzyme, it helps more testosterone convert into DHT. And DHT is 3 to 8 times more powerful than testosterone, depending on where you look. So a lot of those people say 3 to 6 times. I've seen up to 8 times, so 3 to 8 times more powerful than testosterone in regards to a lot of the properties that we think we're actually getting from testosterone often comes from DHT. Guys that do apply it to the scrotum are seeing benefits in cognition, in libido, a reduction in brain fog. They're seeing increases in erections. However, there are some guys that seem to be a little bit susceptible to DHT, where they might get some little prostate enlargement. Most of the time it's benign. They just call it benign prostate hyperplasia. Symptoms of that is when you're going to pee, you find your urine stream is slightly reduced. Outside of that, or they'll lose their hair. They'll find their hair is thinning faster. So what I always tell guys is if you're genetically prone to hair loss and you're upping your DHT, it's gonna likely accelerate that process further. Okay. It's funny enough, I just shaved my head today because I shave it. I barely leave the house anymore because of COVID and I work from home. But I was thinking now I should have not shaved it and showed everyone that I have hair because everyone's like, well, Danny's bald. No, I completely shaved my head down. I just like the way it looks. So is there a benefit to rectally if you find yourself susceptible to DHT related sides, anything where you're raising DHT and either you're losing hair quicker, you're getting prostate enlargement quicker, any other thing, you could always try doing it rectally. Nothing really wrong with that. You'll absorb the testosterone just as much. You just might not convert as much as DHT. Okay, but there are a lot of people that do that. There's a lot of medications that are applied rectally, so it's actually quite common. So I hope that answers your question, Dr. Strange. If there's something I didn't answer, then feel free to add something.